Today I want to talk to you about the next phase of the Scottish Detect Cancer Early programme. And obviously cancer is best diagnosed early because that gives you the best opportunity for successful treatment. And lots of people will be familiar with the Detect Cancer Early programme because we've had the breast screening and more recently the bowel screening programmes. Many of you will remember the Elaine C. Smith adverts for breast screening. And the focus now is on lung cancer. Why lung cancer? Well, lung cancer is the commonest cancer in Scotland, with about 5,000 people being diagnosed every year. And about 4,000 people die every year from lung cancer in Scotland. If you receive a diagnosis of lung cancer, it's not terribly good news. At the moment, the chances of you still being alive after 5 years from your diagnosis is about 8%. And part of the problem is that we're not detecting it early enough. It's a difficult cancer to detect, difficult one to find, and that's partly because the symptoms are often quite vague. So who should we be concerned about? What sort of people might we be thinking are at risk of lung cancer? Well, largely it falls into groups of people who are over the age of 55, particularly in people who have a significant history of smoking, people who have smoked for quite a long time, but also those who come from areas of Scotland which are more socially deprived. So that collection of three things puts you most at risk. Now, clearly, in the last few years, the smoking ban in Scotland has made a significant difference. It's helped a lot, but still it's a significant problem. However, it's not all bad news. Because survival is improving, the chances of you surviving this diagnosis are better now than they were 25 years ago. And there are newer and much more sophisticated treatments available to us now. Obviously, any cancer diagnosis is bad news, but this is something that can be sorted in a way that was never possible in the past, particularly if it's caught early. And your GP can help make the diagnosis, and it's important if you have certain symptoms that you go along to see the doctor to ask whether or not it's possible that this might be a problem. So what sort of things should you be looking for? Well, obviously anybody who has a cough which has changed, or a cough which is lasting for much longer than you would expect, more than you would perhaps expect with a normal cough or a cold, so let's say maybe over 3 or 4 weeks, then at that point you should be thinking about going to see the doctor. Equally, if you cough up any blood in your spit, or you notice a change in your breathing, so if you become much more short of breath, good idea to go and get checked. Obviously, other more subtle things might be if you're losing a bit of weight without trying particularly, or if you've got some chest pains, or indeed if your voice has gone a bit more hoarse and it doesn't go away again over a 3 to 4 week period. And these are all things that might suggest you've got a problem. More often than not, it'll be fine. But the message at the moment really is very much, don't be scared about these things. You're much better to go and get checked. And some of you will already have seen the Alex Ferguson advert on the TV promoting the idea of getting checked. And we can have a little look at that now, if you like.
Being told you've got lung cancer is one of the scariest things you'll ever hear. I know, both my parents died of it. But that was 20 years ago. These days, lung cancer doesn't have to be a death sentence. I'm not going to sit here and tell you it's all good news. Sometimes it's not. But people do survive it, and even if it can't be cured, there's a lot that can be done. You could even get to spend a bit longer with your family than I did. And who wouldn't want a bit of extra time? If you're worried about a change to your cough, see your GP as soon as possible.
So there we are, that's Alex Ferguson telling you very clearly not to get scared, but to go and get checked. And obviously there are simple things that we can do, send you for a chest x-ray, we'll examine your chest, and that will give us a good indication of whether or not there's a significant problem. But don't get scared, get checked.